So right now I'm getting ready to go to my treatment. It starts with putting on my port cream, and that numbs the area so that it doesn't hurt as much when they put the needle in, because it does kind of hurt. And it's a pretty standard day. Only Chris is actually going to be taking some professional pictures of me for the hospital to use. So yeah, I'm getting ready to do that right now. Port's all ready. My port is down kind of far, so if anyone's ever had a port, you're probably thinking, why is it down there? That's just where it was put. Now I'm going to put on some makeup, which I normally wouldn't do for my treatment, because they do give me some Benadryl that makes me super sleepy. But you know, because we're having the pictures taken, that I want to look a little more presentable. I'm not the best at doing my makeup, but I'm getting better, I think. Now, one of the dilemmas I always have is to lash or not to lash. I've gotten a lot better at putting on eyelashes. They're really hard to do, but I figured out how to do them pretty well. But the thing is they don't last very long, so I have to be very selective on, you know, when I put them on. I know there are other options out there that last longer, but these are the only ones I've found so far that I really love. And you know, my eyelashes right now, I have them, but they're very short, so they don't look very good. Mascara doesn't even pull them up. Like, they just kind of just stick straight out. So, and you can't see them very well. So I'm always like, should I put them on or shouldn't I? You know, I like to save them for more special things. I'm not thinking the pictures are going to really show anything, but I don't know. So that's always my dilemma. I have one pair left before I have to buy some more. So, okay, so I think I'm gonna lash today. I probably should have cut them. Eyelashes are always much longer than my eyelid, but it'll work. I'm not doing it again. Definitely should have cut it. So I did end up having to put it back on again, because I really did need to cut it. It was like coming all the way down here. So I did cut it and put it back on. Luckily, it did go on good again. So yeah, it's a fun life trying to be pretty, or just getting your normal features back. I never really had long eyelashes, so they were never like this, but I could at least pull them up with some mascara. I don't know. Hopefully they'll be back somewhat soon. It feels like forever. I stopped chemo like 6 months ago, so. Now, also, my eyebrows. I think they came out, like, they didn't come out completely, but they've thinned out again. So I don't know what's up with that. So I have to draw my eyebrows on, which I am going to do right now. Now, if anyone's interested in how I do this, I basically just follow the hair growth, and I use a brow pencil and just kind of fill it in. Like I said, I am not the best at doing makeup, but after going through chemo and having, you know, your face kind of get bald looking, you learn ways to do this. Sometimes I have to use like a little brush to kind of blend it a little bit better, but I don't know if you can see the difference. Yeah, because sometimes it like kind of gets a little too dark in certain spots, so then I have to just take a brush and blend it a little bit. Okay, so that's my eyebrow. That's my sort of eyebrow. This one's difficult to do. You know, I'm getting older now, so I have more wrinkles going on, so sometimes when I'm trying to draw this in, the pencil likes to get super concentrated in a wrinkle spot, and it's kind of annoying, but such is life. You know, I used to fear getting old. Now I want the privilege to get old. It's funny how having cancer makes you appreciate the fact that, you know, living a long, full life is really the goal. I still want to look pretty. At least once in a while. Okay, so I'm pretty much done. Nothing too fancy. It matches my hair. That's the other thing. I thought my hair would be a lot more gray when it came in, and it's really not. I have a few like little pieces of glitter mixed in, but it's really not as gray as I thought it would be. So I'm happy about that. Now I'm adding a little pomade to my hair just because it gets so like fluffy looking. I look like a Q-tip. And my little bow. Can't forget my bow. Okay, so basically the rundown of the day goes like this. I get there, I check in, I get my beautiful bracelet. I sit down, I wait for them to call me in. Then I get blood work taken from my port. And then I wait for the doctor, talk to her for a little bit, and then I go to treatment. I take 2 drugs for my HER2 positive status, Herceptin and Perjeta. They each run about 30 minutes each. So the visit itself is usually at least 2.5 hours long for everything. So yeah, and then that's that. Bringing back my scarf for some photos. That sound that wakes you up. Or my glamorous life.
There you go. All
right.
All right.
All set.
You're all set.
All right.
Thank you so much.
Thank you. We'll see you in a couple of weeks.
Okay. Well, that's it. I'm done with treatment now. I'm probably going to be very sleepy for the rest of the day, so there'll be nothing more to really vlog about besides me sleeping on the couch probably. So I will end here and I'll see you tomorrow. Bye.